आयुष में असिस्टेंट एडवाइज़र आयुर्वेदा हूँ और मैं यहाँ पे 6 साल से काम कर रहा हूँ मिनिस्ट्री ऑफ आयुष में। और मेरे साथ डॉक्टर वकार अहमद भी है जो रिसर्च ऑफिसर है यूनानी से। आज यूनानी का सेशन है इसलिए हमने उनको भी इनवाइट किया है कि अगर कुछ आप लोगों का क्वेश्चन आता है तो वो भी एड्रेस कर पाए। नेशनल आयुष मिशन इज़ ए सेंट्रली स्पॉन्सर्ड स्कीम। इसमें सेंट्रल और स्टेट का रेशो है, जैसे नॉर्मल स्टेट्स के लिए 60:40% है, नॉर्थ ईस्टर्न स्टेट्स अगर है और हिली स्टेट्स है तो 90:10 है। कुछ इशू और जो यूनियन टेरिटरीज अगर है, जो जहाँ पे लेजिस्लेचर अगर है तो 60:40 है, और विदाउट लेजिस्लेचर अगर है तो 100% ग्रांट सेंट्रल गवर्नमेंट से अंडर नेशनल आयुष मिशन उनको उनके एनुअल एक्शन प्लान के माध्यम से जो भी प्रपोजल्स मिनिस्ट्री को प्राप्त होते हैं अगेंस्ट देयर प्रपोजल्स एज पर द प्रोविजंस ऑफ द NAM गाइडलाइंस, मिनिस्ट्री ऑलवेज सपोर्ट्स। दिस स्कीम वाज लॉन्च्ड ड्यूरिंग द ईयर 2014, September 2014 it was launched, and scheme is now continued till 2025-26 by the Union Cabinet. During the meantime of the implementation of this scheme, a new component of operationalization of Ayush Health and Wellness Centers was added in the year 1920, and accordingly ministry has received a target of 12,500 Ayush Health and Wellness Centers to be operationalized. These Ayush Health and Wellness Centers, now renamed as Ayushman Arogya Mandir Ayush, in short I will say AAM Ayush. We have already approved 12,500 Ayushman Arogya Mandir Ayush in states and UTs as per their proposals, and as of now 12033 Ayushman Arogya Mandir Ayush are functional. And next is, these are the components under National Ayush Mission NAM. The major components are Ayush services and Ayush educational institutions. Under Ayush services there are some activities I have highlighted, including Ayush public health programs. First one is Ayushman Arogya Mandir Ayush, that I have already explained, about 12,500 centers. Second is co-location at Ayush facilities at primary health centers, community health centers and district hospitals. I think all you are aware about the co-location. It is having a dual control. One is training and manpower is being support, their remuneration of the manpower is supported by the National Health Mission, and we under National Ayush Mission NAM, Ministry of Ayush is providing support for medicine, contingency and infrastructure development if it required as per the provisions of the NAM guidelines. Then upgradation of the existing government Ayush hospitals and even dispensaries also. We are providing grant for upgradation of the Ayush hospitals, either Ayurveda or Unani or homeopathy or having two streams maybe. So we are providing grant to all the hospitals, Siddha also, in Kerala, Tamil Nadu, Puducherry we receive proposals for the Siddha also, so we are supporting them. Then even one component has been added, that like construction of the new Ayush dispensaries. If the dispensaries are not available in the state or UT of a particular stream, and if they want to construct, so they can propose us. The land is the prerequisite that should be available with the concerned state and UT government. Next is setting up of 50, 30 and 10 bedded integrated Ayush hospitals. Why I have mentioned these activities? Because these are the centers, co-located facilities or Ayushman Arogya Mandir or integrated Ayush hospitals, 50, 30 or 10 bedded, through which you have to run the musculoskeletal diseases programs. Already 137 integrated Ayush hospitals approved till 22-23, and 38 of them are functional. Next is supply of essential drugs. To implement any program, there is a need of medicines. So under National Ayush Mission NAM, we ensured that state government must submit us the proposals for supply of essential drugs for medicines, for hospitals, for Ayushman Arogya Mandir Ayush, for dispensaries, or even for co-located facilities also. Under co-location we provide medicines. Next is Ayush public health programs. In next slide I will explain in detail. Ayush educational institutes, there are majorly two components. One is either upgradation of the already available government UG or PG institutions in the state. UG institutes 5 crore is the provision, for PG institutes 6 crore is the provision. Then next is setting up of new Ayush education institutes if the institute is not available in the state, or if available it is the number is inadequate in that state or UT. So for this 70 crore is the provision. Total provision is 70 crore as one-time assistance. Those two were the major components of the National Ayush Mission NAM, Ayush Services and Ayush Education Institutes. These are some activities where financial assistance is also provided for under FlexiPool. I have mentioned some activities that like Yoga Wellness Center, telemedicine, then sports medicine through Ayush. Some states submit us the proposals for sport people having with sports injuries, and they are treating with Ayurveda or Siddha or Unani, so we are supporting them. Reimbursement of the testing charges, some medicines testing is required, for reimbursement we are providing support. IEC activities, so campaigns, camps or any other IEC activity, any under these activities we support for all these systems, IEC material development for school, even under school health program or Vayomitra program I will explain. For that purpose also IEC material is required, that can also be taken from here. Training and capacity building of the Ayush manpower. Then support for HMIS and DBT tracking system. NABH accreditation of the Ayush healthcare facilities. Ministry has already MOU with Quality Council of India through its Board of Accreditation for Hospitals, that is NABH. So we have a target of assessment of 2000 Ayushman Arogya Mandir at first phase, and almost 1300 have been assessed, and out of that 591 arm Ayush have been certified for Ayush entry level certification. These are the 8 Ayush public health programs that we have included in our guidelines targeting the different peoples, like integration of first one is for the osteoarthritis and musculoskeletal disorders. Second one is NPCDCS, integration of Ayush with NPCDCS. This program was run by the 3 councils earlier in collaboration with DGHS, and it was run in the 6 states, Gujarat, Gujarat, then West Bengal, Uttar Pradesh, Andhra Pradesh, Rajasthan, and 6 states. Uttar Pradesh for Unani, Gujarat, West Bengal and Andhra Pradesh for homeopathy, then Rajasthan, Bihar and Gujarat for Ayurveda. Now this program is included in National Ayush Mission for implementation in a program made in those 6 states where it was running, and under FlexiPool also we are supporting the state UT governments for this. Then Vayomitra, this is for the geriatric population. Ayurveda, this program is for the school children. We have the target to cover the 75,000 schools in 3 years. Then Ayush mobile medical unit. Mobile medical units are also the essential need of the hour, and we have to give the services to the people by reaching their homes and having camps in the vicinity where Ayush facilities are not available. Karunya, this is for Ayush palliative services. Main object is the visiting the patients at home, domiciliary visit, and improving their quality of life. One is morbidity management and disability prevention for lymphatic filariasis. So I think Bihar, Chhattisgarh, Madhya Pradesh, Uttar Pradesh, there are patients of lymphatic filariasis found. So we have included this program also. This is the background why this program is included under National Ayush Mission name. I will come to the musculoskeletal disorders program, because look at the figures. First is the morbidity, major cause of the morbidity. Then second one is this disease is having direct costs to the healthcare system and indirect cost through loss of work. This burden is increasing day by day on the patients. The global prevalence of MSDs ranges from in some states it is 14%, some countries, and in some countries it is 42%. In India, community-based prevalence of in the epidemiological studies suggested that the prevalence of this disease is 20% and occupation-specific prevalence found as to be high up to 90%. WHO also estimates that 40% of the people over the age of 60 years suffer from MSDs and about 80% of the people have back pain during their life. Approximately 1.71 billion people have musculoskeletal disorders और इसमें भी commonest condition है low back pain. Low back pain being the single leading cause of disability in 160 countries. So this source of the data is Global Burden of Diseases 2019. This is also available on the website of the WHO. The need for Ayush intervention for these musculoskeletal disorders. These are some points where one point is 60 to 90% of the arthritis patients are likely to use the complementary and alternative medicines like Ayurveda, Siddha and Unani systems of the medicines. There is no dedicated program for these diseases. Under National Health Mission, there are programs for the non-communicable diseases that are running in the country, but no dedicated program for the MSDs. Second thing is more focused attention is required, keeping in view the figures as mentioned in the last slide. Then to popularize the safe, effective and Ayush interventions, the awareness generation is also required in the people that our systems have the treatment available for these diseases, or we can improve their at least quality of life, which is the ultimate goal of this program. To address national commitment, like sustainable development goals, there is a third goal, good health and well-being. And our national health policy also envisages the provisions of mainstreaming of the Ayush. So to achieve this program was included in the National Ayush Mission Lab. These are the two are the major objectives. First one is the most important objective is improve the quality of the life of the people. Then implementation of the program, providing treatment to the patients, management of the osteoarthritis, awareness generation through the IEC material in respect of these diseases. Strategy for implementation of the program, we need some centers where the program is required, through how you can implement and how the data is to be collected. So these are the centers like Ayushman Arogya Mandir means Ayush Health and Wellness Centers as earlier. Ayush dispensaries, co-located facilities, Ayush hospitals, we have our national institutes. For example, Unani, National Institute of Unani Medicine is there. One center is now being set up at Ghaziabad. Ghaziabad also, already in Bangalore it is functioning. And CCREM also have its peripheral institutes throughout the country. So these centers can also run this program or can provide support to the doctors or manpower who are running this program by giving your technical inputs. You are the experts for this. Then teaching hospitals, Ayush education institutes are also available, including Unani also are available throughout the country. Co-located units, then peripheral units of research councils already mentioned, national institutes and other linked health facilities if available in that particular states. This is the strategy for generating awareness on preventive measures, screening of the population, employing yoga, diet, lifestyle. In Ayurveda, some Shodhana systems are mentioned. In Unani system also this has been mentioned. Then Siddha Varma therapy is there. Then this application of the medicated oils is natural, or tambric is the Unani word, application of the medicated oil. Then levels of the service delivery at community level, then at first level centers and then referral centers. So at community level, we can utilize the services of the UG and PG students as a part of their internship for implementation of this program. Then campaigns are required to create awareness. Then we have to go in the outreach, and camps required to be conducted. Screening of the patient is required to be done. Then we have to encourage them that treatment is available for these diseases. You can come to our centers. Then registration can be done for that patient, and regular follow-up is also required to be done. Then these are Abhyanga. This is Ayurveda terminology. Yoga, particularly those postures which are likely to cause regeneration of cartilage. You can provide them suggestions over diet, importance of the exercise, sunlight exposure, use of medicinal plants or spices for various risk and morbidity groups. Then referral of the patients to the next level centers. This is the next level centers are first level healthcare facilities. These are Ayush dispensaries or co-located facilities based on the proximity to the population. National institutes where you can refer the patient. There are experts are available who can treat the patient very well. They can suggest about diet, lifestyle, exercises. If yoga expert is available, then yoga intervention can also be made. Allopathic dispensary or hospital, if there is a severity and you think that there is requirement of some allopathic treatment, or allopathic investigations are also required for the diagnosis. If there is a confusion, then you can refer the patients to the allopathic dispensaries, and these dispensaries can provide their support to us. These are the referral facilities. Requiring further diagnosis, like patient came at Ayushman Arogya Mandir and their Panchakarma or Ilaj with Tadbik, as mentioned in the Unani, these facilities are not available. So the patient must be referred to the higher center. But before referring, his record must be maintained at your center also, and at higher center what treatment he is getting, that follow-up is also required to be done. Because this is in a program mode, whether the patient cured or quality of life is improved or not, this is the ultimate goal. So we have to take care of that also. Then depending on the location, suppose a patient came directly to the National Institute or integrated Ayush hospital, then that facility can act as a primary care center also, because all doctors are available, staff is available, and procedures are also being carried out at this center. So this facility can act as a primary facility also. Continuum of care, that's why I mentioned that once the patient is referred, your job is not completed. You have to take follow-up, and continuum of care must be ensured. This is the referral criteria as mentioned in our guidelines, and even STG also you will find some points regarding referral criteria. When the referral criteria for the Ayush facility, from allopathic sides, unclear diagnosis, patients having contraindications of NSAIDs, because painkiller drugs, mostly people take painkiller drugs, or allopathy side also prescribes painkillers, NSAID drugs. Then patients who prefer our systems, they can be managed at our facilities. Then for expert consultation, this is for cross reference. We can take expert consultation of allopathy side, and they can take expert consultation of ours also. If it is running in a co-located facility and patient is registered at allopathic side, they can suggest that co-located facility Ayush or doctors are also available, you can take treatment from them. So this is convergence mechanism is also required in between the health and Ayush department in the states. Then further investigations, if a facility there are investigations available, then we can refer the patients to the higher center. Same is here, suspected cases of tuberculosis or malignancy or autoimmune diseases or uncontrolled comorbidities, if during the investigation or taking history of the patient we observe these things along with musculoskeletal disorders. So for that purpose we can take opinions of the allopathic doctors also. Modalities of the implementation, then that's what I said, ki there should be a convergence between the health department and Ayush department in the states. Then classification, stage wise management of each disease and referral criteria, this should be followed. If there is a need of Ayush intervention, patient If suppose in Unani you are practicing and there is a dispensary and higher center is available far away of your system, but nearby there is a Siddha system or Ayurveda system, then you can refer a patient to that facility also. But follow-up is to be done by the concerned center where patient is registered. Then screening of the patients, health camps I already mentioned, continuum of care we have to ensure. Then lifestyle, dietary modifications, these are the points for which we have to take care of the patients. Then community mobilization through self-help group and panchayat. Our some self-help groups are also there. Then panchayati institutions like Gram Panchayat, these can be included. Sarpanch, role of Sarpancha is there for awareness among the people that this type of facility or program is being implemented at this facility, so people can avail our Ayush services. Then cross referrals between medical colleges, CSCs, PS, matlab our centers to higher centers and for allopathic centers also. Periodic monitoring, this is the most important point. Monitoring and evaluation of the program is also required being done at the directorate level in the state. Prioritized conditions already mentioned by Dr. Raghu sir, these 6 conditions already in the slide. So rheumatoid arthritis, osteoarthritis, lumbar spondylosis, cervical spondylosis, fibromyalgia and adhesive capsulitis. These are our interventions. First one is preventive measures, second is clinical management, third is therapeutic procedures, then diet lifestyle modification. Some points I have mentioned here, like Ayurveda, Unani, हमारा पंचकर्मा बोलते हैं, सिद्धा में ठोकना में, आपके सिस्टम में इलाज बिट तडबीर बोलते हैं, और वर्मा थेरेपी भी सिद्धा का है. फिर ये उपनाह, लेप, पिचू, दीज आर आयुर्वेदिक टर्मिनोलॉजीज आई हैव यूज्ड. Exactly what terminology is to be used for this, that will be explained by the Unani experts to you. Then yoga and physiotherapy. This is our data collection and monitoring. How to collect the data, the format is in the next slide. How to monitor the scheme, this is to be, SOP is required to be developed by the state and UT government for monitoring, so that further reporting may be provided to the Ministry of Ayush. Then financial assistance, under this program we support remuneration of the salary of the Ayush doctors at the rate of 40,000 per month, and one MPW is also there for 15,000 per month, and for IAC material and campaigns we provide training contingency purpose 2.4 lakhs per block.
It means we can hire
per block officer. This is the provision, sir.
We can hire a medical officer for this purpose.
These medical officers are to be hired by the directorate of your state.
Yes.
But do you know about this program? Before coming here, are you aware about this program?
Yeah.
So if you have some
if you hired this MPW, such programs we have
okay.
already hired.
Okay.
But
you are from Jammu Kashmir?
Yeah.
Okay.
We have already hired.
Okay.
The second part is we have not hired this medical officer, because we have in these centers we have already medical officers.
So already
we can hire one more.
Yes, it is required, sir, for implementation of the program. You cannot overburden a doctor already available.
That is
so we have made this provision, sir.
So one more thing, for hiring a Ayush doctor, even by the directorate, they have to send the file to every department
Yes.
and get the approval.
So
That takes time.
it is actually state to state, the procedures of the approvals varies.
National Ayush Mission directly. So we don't need to send you to any other director.
So these are the states issues, state to states taking approval varies. For example, in Manipur, for deployment of the contractual manpower, they need to take the approval of the cabinet. So the procedure is too lengthy. This is the data reporting format. This is already available under National Ayush Mission guidelines, and I have mentioned here that how many facilities initiated this program, how कितना कैंप किया, कितने पेशेंट को बेनिफिट हुआ, कितने पेशेंट फॉलो अप के लिए आए, कि कितने पेशेंट्स ऐसे हैं जिनकी क्वालिटी ऑफ लाइफ में इम्प्रूवमेंट हुआ. क्वालिटी ऑफ लाइफ कैसे इम्प्रूवमेंट होगा, इसके लिए आपको कुछ ना कुछ अपने पैरामीटर्स डिसाइड करने पड़ेंगे. आप चाहे वोमैक्स स्केल को यूज़ करो, चाहे वैस विजुअल एनालॉग स्केल को यूज़ करो, चाहे SF36 क्वेश्चनरी है, इसको यूज़ करो, बट SF36 क्वेश्चनरी ज़्यादा अच्छा है फॉर मेजरमेंट ऑफ द क्वालिटी ऑफ लाइफ इम्प्रूव्ड. So this is the WOMAC scale regarding Western Ontario McMaster University's Orthostatis Index. So there are certain criteria, like I have hyperlinked this slide. For example, WOMAC measures 5 items: pain 0 to 20, 2 for stiffness, and 17 for functional immunity. So 17 plus 2 plus 5, there are total 24 items. So I will have click here. How to click?
दूसरा वाला आपके हाथ में
नहीं, इससे नहीं होगा. देखिए उसको हाइपरलिंक, हाँ नहीं, नेक्स्ट स्लाइड है. दिस इज़ विजुअल एनालॉग स्केल. इसमें पेशेंट जैसे 0 से 100 तक हम मार्किंग करते हैं, एक्सट्रीम मार्किंग्स 0 एंड 100. वो पेशेंट को बोलते हैं कि कितना पेन आपको हो रहा है, तो उस पॉइंट पे आप उसको मार्क करिए. तो अकॉर्डिंगली इसमें डिसाइड होता है कि उसका पेन कितना है. मार्किंग 0 से 5 तक है, 5 से 44 है, 44 से 74 है, एंड 75 एंड अबव. तो अकॉर्डिंगली हम स्कोरिंग करते हैं बिफोर एंड आफ्टर ट्रीटमेंट. तो उससे भी होता है. ये है वोमैक स्केल के टोटल क्राइटेरियाज. ऊपर जाना. 5 फॉर पेन, 2 फॉर स्टिफनेस एंड फिजिकल फंक्शन के लिए 17. तो इसमें स्कोरिंग किया है. कुछ भी पेन नहीं है 0, स्लाइट 1, मॉडरेट के लिए 2, वेरी पेन 3 और एक्सट्रीम पेन इसके लिए 4. तो अकॉर्डिंगली बिफोर आप एसेस करेंगे, आफ्टर एसेस करेंगे, तो आपको पता चलेगा कि उसकी क्वालिटी ऑफ लाइफ में कितना इम्प्रूवमेंट है. मैक्सिमम इज द स्कोर, मैक्सिमम इज द सिवियरिटी ऑफ द पेन. मेन स्लाइड पे. Next was I have already mentioned, no pain 0 to 4, mild pain 5 to 44, moderate 45 to 74, severe pain 75 to 100. And this is SF36 questionnaire. This questionnaire is developed on the basis of these physical functioning limitations of the activities, emotional health problems, social activities, pain, energy and emotions, and one point for the general health also. So you can hyperlink this. So ऊपर जाना सबसे. SF36 questionnaire. One is for general health, and then certain points are there. Total 36 questions are there. So based on this also you can assess the quality of life improved or not. So next हमारे slide पे आ जाना, presentation पे. You can just Google it, SF36 questionnaire. Many of you may be aware about that. If not, you can Google, you will get this. This is record maintenance. This is the most important slide in my presentation, because always ministry asks about the reporting, how many camps you conducted, कितने पेशेंट हुए, कितने पेशेंट का रेफर हुआ, रेफर होने के बाद रिकॉर्ड मेंटेनेंस किया कि नहीं किया, कितने मेल है, कितने फीमेल है, कितने ट्रांसजेंडर पेशेंट्स आए, क्या एज ग्रुप के पेशेंट्स है. तो ये वाली चीज़ें स्टेट लेवल पे मेंटेन तभी हो सकती है जब वो नीचे भी ये चीज़ों को बताए कि ये रिकॉर्ड मेंटेन करना, कितने सेंटर्स पे ये चल रहा है. तो वो सेंटर्स पे पेशेंट का रिकॉर्डिंग रजिस्ट्रेशन, नेम, एज, जेंडर, अगर आभा आईडी बनाया है तो क्या नंबर है, ताकि वो आगे भी ट्रैक हो सके. नहीं बनाया है तो उसको बताइए कि आभा आईडी भी बनवा लीजिए. वेरी सिंपल प्रोसीजर इज देयर. दिस इज आधार बेस्ड. क्या सिम्टम्स है, क्या प्रोविजनल डायग्नोसिस किया आपने, अगर उसको रेफ़र किया है तो कहाँ पे रेफ़र किया है, वो सेंटर के साथ आपका टाई अप होना चाहिए. मतलब रेफरल सेंटर्स आपको डिसाइड करने पड़ेंगे. स्टेट को जिसको भी आप बताएंगे आगे, उनको भी बताना पड़ेगा कि रेफरल सेंटर्स आपको डिसाइड करने पड़ेंगे. यहाँ से यहाँ रेफ़र किया है तो कितने पेशेंट को रेफ़र किया, फिर वहाँ से फॉलोअप भी लेना पड़ेगा, कितने लोग अच्छे हुए हैं, कितने लोगों का क्वालिटी ऑफ लाइफ इम्प्रूव हुआ, बेस्ड ऑन द डाटा रिपोर्टिंग फॉर्मेट. देन रिकॉर्डेड हायर सेंटर पे भी जितने पेशेंट को रेफ़र किया उनका भी रिकॉर्ड वहाँ पे होना ज़रूरी है. इम्प्लीमेंटेशन इन ए प्रोग्राम मोड इज़ रिक्वायर्ड. मतलब ये प्रोग्राम मोड में करना है, ऐसा नहीं है कुछ भी डाटा भर दिया, भर के मिनिस्ट्री को रिपोर्ट कर दिया. जब यहाँ से जैसे अभी मिड टर्म इवैल्यूएशन भी स्कीम्स का होता है, तो एक स्टेट की टीम भी करती है, फिर सेंटर की टीम जाती है, फिर नीति आयोग या पीएमओ के से भी लोग जाते हैं। जनरली नीति आयोग से जाते हैं मोस्टली, बट कभी कभी सीनियर ऑफिसर्स भी मिनिस्ट्री के बाहर विजिट करते हैं, तो कोई सेंटर देखना चाहते हैं तो वहाँ से वो डाटा ले आते हैं, फिर हमारे यहाँ पे मैच नहीं होता, तो वो डाटा मेंटेनेंस ऑफ द रिकॉर्ड इज ऑल्सो इम्पोर्टेंट थिंग। देन अवेलेबिलिटी ऑफ द इसेंशियल मेडिसिन मस्ट बी इंश्योर्ड। अगर आप हायर सेंटर कर रहे हैं तो वहाँ पे ये भी देखना है कि मेडिसिन उस प्रोग्राम को रनिंग करने के लिए अवेलेबल है कि नहीं है। नहीं है तो स्टेट को बोलना है कि सैप में आप मेडिसिन की अवेलेबिलिटी हो सके ऐसे तरीके से प्रस्ताव भेजिए।
सर, तो हायर सेंटर में जब हम लोग रेफर करते हैं
जी।
उनका रजिस्ट्रेशन वहाँ की सेंटर का सेंट्रल ओपीडी का रजिस्ट्रेशन रहेगा, इसके लिए अलग से हम लोग रिकॉर्ड रजिस्ट्रेशन भी अलग करना पड़ेगा और record भी अलग
आपको बताना पड़ेगा कि ये मस्कुलोस्केलेटल डिजीजेज के प्रोग्राम के अंडर पेशेंट रजिस्टर्ड है, वो पेशेंट का रिकॉर्ड आप उनको मेंटेन करना पड़ेगा, और ताकि वो ठीक हो गया नहीं हो गया, आपने तो रेफ़र कर दिया, आपको कैसे पता चलेगा कि पेशेंट ठीक हो गया है करके। तो वो रिकॉर्ड वहाँ के डॉक्टर से आप जब रेफ़र कर रहे हैं तब आपको टाई अप भी करना पड़ेगा। फॉलो अप इज मोस्ट इम्पोर्टेंट। Then these need for standard treatment guidelines, Raghu sir has already explained in his slide why standard treatment guidelines for musculoskeletal disorders have been prepared. These are the things like diagnostic criteria, many of you knows, but still it is mentioned. The clinical diagnosis, what supportive investigations required to be done, what is the prognosis, what is the standard treatment at primary level, at referral centers, or as per the prognosis of the disease, what interventions for Ayurveda, Unani, Siddha, homeopathy, different interventions are there. So today the Unani interventions will be informed to you. Then referral and complications if any, so we can refer the patient. This slide is these are the tentative figures I have mentioned here as per the proposals received from the concerned states and UT governments, forwarded by their health or Ayush department to the Ministry of Ayush under National Ayush Mission NAM. So for example, we have approved this program to be implemented in 683 blocks during this year 23-24, during the last year. We approved during 22-23 also, but many of the states have not received grant, full grant. Some received one installment, some received two, some received three. So they may not have allocated funds for this program. But this is the figures of the last year. I have ensured from these states also, but this is the number of the blocks, 683 blocks. Thank you so much for listening so politely and I am thankful for giving me the opportunity, DGHS team and Dr. A. Raghu sir, DDG Ayush, and state and UT governments who nominated you as a trainee for this program. You will be the master trainer for this program. And I request you, when you go to your state, kindly have interaction with your directors, your departmental directors. If Unani director is separate available in your state, request them for this program. The proposals are required to be submitted through annual action plan. They are well aware about the annual action plans. You have to just insist on, request them. We have to submit the proposals for this program, and we are ready to provide any technical support after getting training from this. And this is your responsibility to provide training within the 3 months to the concerns. Thank you so much.